I'm Emma Jones. I'm the service manager for the ARRS mental health service that sits within primary care, and the team is a newly developed service that's been going for, I think we're in a second year, and it's part of the community mental health transformation and the mental health support offer within primary care.
Hello, my name's Eve Homer. I'm a mental health practitioner. I work within moorlands and rural area, covering 7 practices within that area.
And I'm Chris DeVille, and I work in the South Newcastle PCN. I'm a mental health nurse by background, and I cover 6 practices within the Newcastle and sort of more rural areas around there.
ARRS stands for Additional Roles Reimbursement Scheme, and it's part of the community mental health transformation in terms of the mental health practitioners, but there are also other ARRS roles that sit within primary care. So each primary care network has got roles such as an occupational therapist, social prescribers, health and wellbeing practitioners, paramedics, pharmacists. So we all sort of work together within primary care to provide that sort of multidisciplinary approach to mental health assessment, guidance, support and interventions within a primary care setting. We've got, there's 13 primary care networks that we cover, so across North Staffordshire and Stoke. We've got 13 mental health practitioners that are aligned to each primary care network. Within each primary care network, there's an average of sort of 5 to 6 GP practices. And then we've got support time and recovery workers that are aligned with the mental health practitioner to each PCN to offer a recovery-focused approach to support mental health.
The objectives obviously are to provide earlier intervention for people with mental health who are experiencing mental health difficulties. Obviously that will aid combined in the sense that we're looking at not as many people needing to go to places like access services, hopefully reducing the pressures on those teams, but also providing a smoother pathway for people and hopefully that trusted assessment so that we can see somebody in a primary care setting, and should we feel that they need something such as CAMS or community team support, then we can refer directly to them rather than having to see somebody in primary care, somebody at the access team, somebody, and then they have to have another assessment again. So it's about improving the patient journey.
What we're hoping to do is see people who fall between primary and secondary care. So if a patient has been within secondary services, the discharge pathway can include ourselves, it can be a step down to ourselves. Also, if someone's come from primary care and we feel that they need extra support, we can provide an intervention. And if we've seen someone, several times and we feel that this still isn't quite the right treatment, the correct care, we can then step up and someone can go through to secondary services. So we are sitting in between the two.